So, Alane Watkins, you have considerable understanding of management of your own cancer. What can you tell us about the use of repositioned or repurposed medicines within the context of the cancer you have?
Well, I have a rare cancer, and there are not many traditional therapies available to me to try. And so, repurposed meds, there are actually dozens of medications on the market today. Many of them are off patent with the original drug companies that have anti cancer qualities. And if taken in a strategic way, and when the body is in a certain condition, so to speak, in other words, maybe you fast or whatever to get to that appropriate state, these repurposed medicines can be pretty effective at stalling cancer, slowing it down, and providing an adjunct to traditional therapy.
So, when you say a state, and you mentioned fasting, another thing would be your supplements, your use of supplements to get you in that state,
Correct.
and exercise. And what are the things you're considering?
So when I go through what I call a kill cycle, a cancer kill cycle, typically I fast. I want to put pro-oxidative stress on those cancer cells.
So, fasting for how long?
At least 48 hours.
Okay.
Preferably more like 48 hours. And then, even as I start the what I consider the kill cycle, I sort of, let me back up a little bit. I create a runway of ketogenic eating because cancer cells tend to use fat less often as a primary fuel. So I gradually work carbs out of my diet, and then I go into a fasting mode, either an all-water fast or a fast with approximately 500 calories of ketogenic food. So nuts, olives, vegetable broth, minimal vegetables, keeping the carbs to about 35 grams or less. So I'll do that. I'll create that runway into a kill cycle. I'll start my fast, and then I onboard repurposed medicines to help take the cancer out. So the idea is weaken the cancer cells, create pro-oxidative stress, and then zap it with drugs. And this can be done with traditional therapies as well.
Do you have a ramp up of the repositioned or repurposed medicines you use to get them at steady state levels? Do you start them at the same time you start fasting?
I think you have to understand why you're using the drug, what the research shows, what doses were being used in the research that support the anti-cancer qualities of those drugs. And in some cases, you're using, like in the case of valproate, it has neuroprotective ability. So if you're using another repurposed med that could potentially be hard on the nerves, on your nervous system, you could use valproate to temper that effect. Same with steroids. And steroids are used actually in conjunction with chemotherapy to counter some of the allergic reactions that happen during chemo. So I do the same thing with repurposed meds, understanding what the medicine is doing, what it can do in terms of the cancer, and then what can offset some of the negative effects without taking that cancer kill quality away.
Very good. So people have been using repositioned or repurposed medicines for quite some time, it appears, and there's more and more use of them. You've used them for multiple kill cycles, it sounds, and you've tolerated them. Do you have an intuitive or an empirical understanding of their benefits? Hard one, huh?
Yeah, that's a hard question.
Are you operating solely on theoretical benefits? How are you basing your decisions to use these medicines? And what do you suspect the outcomes? And how are you measuring the outcomes?
So understanding the kill pathway of a cancer is important. Understanding the signaling pathways is important. And then developing a real strategy. You can't just, ask a doctor to write a script for a medicine because you want to kill cancer cells, right? You really need the guidance of a physician to help you determine, okay, here's the right mix of drugs for my cancer. It's possible as a patient to understand the kill and growth pathways of your cancer. That information can be Googled. Same with the signaling pathways, and you can actually find the research to do it. But the work of orchestrating these repurposed meds really requires someone with an understanding of biology and an understanding of molecules of biochemistry and understanding how drugs are assimilated in the body. And I think that's something that's harder for the average patient to do if they don't have a medical background.
Right. So I think that's a pretty good synopsis of a compelling reason to do repurposed medicines and some of the obstacles in doing them. And perhaps another video will address some of the specifics of given repurposed medicines to target certain kill pathways. I think that's enough said. Do you want any concluding remarks?
So my closing remarks would be that as a patient, you really need a well-honed strategy. Even in the space of rare cancers, you need to take the time as a patient and work with your physicians to develop a strategy of how you're going to knock it down. Your strategy may be this simple. It may be, I'm going to keep my cancer at bay. I'm going to slow it down with diet, exercise, supplementation, repurposed meds, and I'm going to wait for the better cures, future cures, to help me. That may be a strategy. Right? As opposed to another strategy may be palliative care. I just want to keep the symptoms of my disease from interfering with life, right? But I understand that what I have is not curable. I actually believe that all cancers are eventually curable.
I suspect that they are too.
Yeah,
So.
and I think that that's, a patient should not feel reluctant to go out there and for themselves find the cure. And the cure may be where you're not looking for it. So, but a strategy is really important. If you don't have a strategy, you're flying around in the wind with your disease. And you likely are going to make decisions that are not consistent with a good strategy. And that could hurt you down the road. The last thing you want to do is use a chemotherapy that is not effective for your cancer that precludes you from future better treatments.
Right.
And then at the same time damages the body. So it's not just that chemo damages the body, it's that it may stop you from being able to participate in a clinical trial for a new drug that's deemed a cure for your cancer. So use your therapeutic agents, judiciously. They should be used just when you need them.
Right.
And don't necessarily think that you have to annihilate the cancer at the offset.